So people wonder, gee, if I'm going to spend all that money on artificial disc replacement in my neck or in my low back, is it worth it? You know, I always wonder when patients are concerned about pricing, and I know it's expensive, and obviously costs are a real concern, but what's your spine worth? You know, everything emanates from our spine, and motion is key. That's why our spine was created to move, is for mobility, not to be fused, not to be immobilized, but to maintain motion. And motion preservation or motion restoration surgery is so important. I believe it's worth it. And we've actually studied the costs over time, comparing artificial disc replacements in the neck to the costs of fusing a neck. And the actual cost of surgery is more expensive for fusion than it is for an artificial disc, which seems odd. But secondly, over time, the chances of you needing additional surgeries are almost twice as likely if you've had a fusion. So those costs over 10 years are significantly greater if you have a fusion than if you have an artificial disc. So is it worth it? Is it worth it to have full motion of your spine? Is it worth it to have less pain? Is it worth it to have a better chance of less surgeries in the future? Of course it is. We all know that. So you have to look at your own finances to decide what you can afford. And obviously most doctors' offices will do their best. And sometimes we have foundations, and some of the companies will actually offer gratuities and maybe give you the implants for free in hardship situations. So I believe it's worth it. Artificial disc replacement surgery is absolutely worth the price, no matter what the cost is to me. And I've had 8 spine surgeries and I have 4 artificial discs in my spine. And I would never turn back from that.